Bloodborne pathogen exposure control. Introduction. The purpose of this presentation is to train employees to reduce occupational exposure to bloodborne pathogens, BBP. What are bloodborne pathogens? BBP are microorganisms in human blood or body fluids that cause disease in humans. The two more common pathogens are hepatitis B virus, HBV, which may cause a severe form of hepatitis in some or be carried by others, and the human immunodeficiency virus, HIV, which causes AIDS. Methods of transmission. BBP are usually transmitted when disease organisms enter the body through mucous membranes or through breaks in the skin. Intact skin offers some protections against BBP. However, they may be transmitted through the skin via accidental injection when skin is punctured with some sharp object. BBP may also enter the body through open wounds such as cuts, nicks, skin abrasions, and cracked skin caused by various types of dermatitis. Universal precautions. Universal precautions is a method of infection control in which all blood and certain human body fluids are treated as if known to be infectious. Universal precautions are to be observed in all situations where there is a potential for contact with blood or others potentially infectious materials. Engineering controls and personal protective equipment should be used in conjunction with universal precautions when dealing with all body fluids. Safe work practices are general rules designed to further reduce exposure to hazards. Hand sinks are readily accessible to all employees who have the potential for exposure. Employees will wash their hands and any other exposed skin with soap and hot water immediately or as soon as possible after contact with blood or body fluids for 15 seconds in a manner causing friction on both inner and outer surfaces. Eating, drinking, smoking, applying cosmetics or lip balm, and handling contact lenses is prohibited in work areas where there is potential for exposure to bloodborne pathogens. New employees or employee being transferred to other sections will receive training about any potential exposure. Personal protective equipment. Personal protective equipment, PPE, can significantly reduce the health risk for workers exposed to blood and other potentially infectious materials. The PPE will be considered appropriate only if it does not permit blood or body fluids to pass through or reach the employee's clothing, skin, eyes, mouth, or other mucous membranes under normal conditions of use. All PPE used at the facility will be provided without cost to the employees. OSHA's standard. 29 CFR Part 1910.1030 sets forth requirements to protect workers from occupational exposure to bloodborne pathogens. The standard covers all employees who could be reasonably anticipated as a result of performing their job duties to face contact with blood and other potentially infectious materials. OSHA does not attempt to list all occupations where exposures could occur.